Yeah, I'm curious your thoughts. We're going to have new cholesterol guidelines coming up, and since the last guidelines, there's been a fair amount of data suggesting that, I think Donald LeJoynes had the editorial, and he talked about it as part of a sequential risk assessment. First step is obviously to assess your absolute risk and kind of see what range you're in, and then if you're still uncertain about what to do, of all the tests that we have, calcium scoring seems to be kind of the best option at this point. Would you agree?
Yeah, I agree. I think that one of the problems that we've had with the calcium score is that we've talked about it as a screening test. And when you talk about it as a screening test, then you can easily get somebody arguing that, well, really, how does this apply to the entire population? And I think, what you just mentioned about sort of a sequential approach, where you do the basic risk assessment, you try to figure out whether the person is at one extreme or the other. If they're very, very low risk, they have no risk factors at all, you can really be confident of that. Unfortunately, that's a relatively small portion of the population, but if you do identify people like that, I don't think additional testing is necessary. On the other hand, you're going to be people that have really high risk of cardiovascular disease based on their traditional risk factors, and how much more information do we need to be able to recommend treatment for people that are really high risk? And the next step for people where you're uncertain, and I think we've been reasonably consistent about this recommendation for people that were uncertain.
Right.
And that uncertainty could either be my uncertainty as a doctor or the patient's uncertainty or their unwillingness to comply with, let's say, the one-size-fits-all recommendation. Right. In that category. Additional testing looks like coronary calcium would really make a difference in those people.
Now, like you said about the provider and the patients, I think it fits nicely in this concept of shared decision making, where the concept of you're 50 years old, you have a mandate to get a calcium score is very different than I'm 50 years old, my cholesterol is a little bit high, I'd rather not take a medication, I'm not quite sure what to do. Well, let's get some additional information about your level of risk and then make the decision.
Yeah.
I think it really fits nicely in that concept.
I agree.